The following information in this video are guidelines in preparation for your surgery. However, different surgeons may have varying protocols and procedures. Should any information specific to your surgical intervention be different, your surgeon will notify you. We are going to lead you through everything you need to know about pre-surgical exercises to work on at home, how to set up your home to make it easy for when you return, what to bring to the hospital, what to expect immediately after surgery and during your hospital stay, pain management, post-surgical precautions to keep you safe when you go home, post-surgical exercises that will help you with your recovery, and other special instructions for aftercare. Exercising prior to your surgery is just as important as after the surgery. The following demonstrated exercises will help you strengthen important muscles that will facilitate your mobility after surgery and help speed up your recovery. Please consult with your family physician before starting this exercise program. Do your best to stay as active as you can prior to your surgery. Try to maintain a daily walking program where you walk a total of 20 minutes a day, taking breaks as needed. Improving your cardiovascular strength will be very helpful to you both during and after surgery. If your activity is limited due to arthritic pain in your joints, then joining a regular aquafit class at your local community center pool is recommended. An alternate idea would be using a stationary bike, if it's manageable. If you have poor balance or use a gait aid such as a cane or walker, please make sure you have the required assistance to get on and off the stationary bike safely. Strengthening your upper body is very important so that you are able to safely use a walker or any other gait aid. Following your surgery, you may have to rely on the strength of your arms and shoulders in the beginning to take some of the stress off your operated leg. To strengthen and prepare your arms and shoulders, sit on a well-supported, stationary chair with armrests. Slide your soon-to-be operated-on leg slightly ahead and position your stronger leg closer to the chair with foot firmly on the floor. Place your hands on the armrests of the chair in line with your hips. Push your hands down on the armrests and straighten through your elbows so that you raise your hips up off the chair. Hold this position for 3 to 5 seconds and lower yourself down slowly to the starting position. If you have existing shoulder pain or if the armrests are too high, you can perform a modified version of this exercise by placing your hands beside you on the seat of your chair and pushing down through your hands, straightening your elbows. Lift your buttocks slightly off the seat. Hold this position for 3 to 5 seconds, then ease yourself back down. Complete 10 repetitions 3 to 5 times per day. Your hip joint consists of the head of the femur, also known as your thigh bone, fitting into the acetabulum, which is the socket of your pelvic bone. This picture of an arthritic hip shows how your hip may look right now. This picture shows how it will look after surgery. As you can see, the prosthesis will be secured into the bone for strength and stability, giving you a smoothly functioning ball and socket joint, instead of the current rough, bony, painful joint. In addition to the aerobic and arm strengthening exercises, the following 4 exercises will help strengthen specific muscles that will aid you with mobility and recovery post-surgery. Before you begin, you will need an elevated flat surface to lie on. Your bed is an ideal surface. You will also need what's called a quads roll, created by using a thick bath towel rolled up to roughly 6 inches in diameter and 12 inches long, plus a plastic bag. Each of the following 4 exercises should be completed for both legs. 10 sets per leg, 3 to 5 times per day. Lying on your back with your legs straight, slide one leg out to the side and then back to the starting position. If you have difficulty sliding your leg along the bed, try placing a plastic bag under it to help create a slipperier surface and eliminate friction. Lying on your back, squeeze your buttocks firmly together, hold for 5 seconds, and then relax. Lie on your back with your knees bent. Squeeze your buttocks together and lift your hips off the bed about 4 to 6 inches, pushing through your legs and elbows to help raise your hips up. Hold it there for 3 to 5 seconds before returning slowly, lowering to the starting position. Lie on your back and place the quads roll under your knee. Rest the back of your knee firmly on the roll, then lift your heel off the bed. Make sure the back of your knee stays resting on the roll throughout the motion. Straighten your knee fully and hold for 3 to 5 seconds before slowly lowering back to the starting position. Give yourself the best possible homecoming after surgery by preparing your home in advance. Move things within easy reach. Place all commonly used items in areas that you can access without breaking your after-surgery precautions. For example, move food items to the higher shelves of your fridge. Keep everyday items and medications at waist level to reduce any bending, reaching, or climbing. Remove all small rugs from your kitchen, bathroom, or front door as they create a fall hazard. Get rid of clutter. Make sure that your entranceway and hallway are clear and free of clutter, as you will be using a walker when you first get home. Move any loose electrical cords well out of the way so that you do not trip on them. It's helpful to install night lights to minimize your risk of a fall if you get up to go to the bathroom at night. It's important that you have railings along your stairs and make sure that they are secure, as you'll be using them to negotiate the stairs after discharge. If you live alone, it's a good idea to stock up on groceries prior to your surgery and prepare some meals ahead of time. Frozen dinners are also helpful, so you don't have to spend a lot of time cooking. This is the ideal time to rely on family and friends for some additional support. Supportive shoes with an enclosed back heel. Runners are highly recommended. No flip-flops or sandals. Any orthotics or custom splints that you are currently using. If you have any walking aids that you use, please bring them and make sure you label them clearly. A large towel, which will be used to make a roll for your exercises. Understanding what to expect in advance will help you lessen some of your concerns immediately following your surgery. Here is an explanation of what you'll see around you. You will most likely have an intravenous line, which is used to administer any medications straight into your bloodstream. Oxygen via nasal prongs helps in aiding your breathing. Some of you, depending on your anesthesia and course of surgery, will have a patient-controlled analgesic or PCA pump. This is used for pain control by the patient, and the hospital staff will show you how to use it if it is required. Here are some additional things to expect after surgery. The first thing you will notice will be swelling over your operated leg. Swelling is very normal after surgery and is considered part of healing. You will also notice that your operated leg looks pink, due to the antiseptic agent that was applied to it before the surgery. Due to the drugs administered to you during surgery and the pain meds afterwards, you will most likely have some degree of constipation. Getting out of bed, walking, and drinking lots of fluids will help alleviate it, and you'll also receive stool softeners to help. The degree of your constipation will be monitored by your nurse. You will have a multidisciplinary healthcare team who will guide you on your journey to recovery. They will instruct you on the proper precautions to take during your daily activities, such as getting in and out of bed, walking, toileting, and bathing. Initially, you will require assistance from your nurse, physiotherapist, or occupational therapist to perform these activities. Beginning the day after surgery, your physiotherapy team will assess your mobility and recommend a walking aid. They'll also determine the level of assistance you require to safely get around your room and go to the bathroom. They will have you spend time sitting in a chair by the bedside and provide you with instructions for exercises which you will perform either by yourself or with the assistance of family. Your mobility will progress throughout your stay, and instructions for managing stairs will be given before you are discharged. Your occupational therapy team will recommend any additional equipment and dressing aids required to assist you with the activities of daily living. To decrease the risk of forming blood clots, it is highly recommended that you perform the following 3 circulation exercises 10 to 20 times during every waking hour. Foot and ankle pumps. Point your toes and ankle up and back towards you, then down away from you in a smooth motion. Keep hips and knees still, only your ankles move. Static quadriceps. With your legs straight, press the back of your knees down into the bed by tightening the muscles on the top of your thigh. Hold for 10 seconds, then relax. Static glutes. Keeping your legs straight, squeeze your buttocks together, hold tightly for 10 seconds, then relax. You will also be required to practice deep breathing, in through your nose and out through your mouth, to decrease the risk of any cardiovascular complications. It's recommended that you take 4 deep breaths followed by 1 cough once every waking hour. This will help you wean off the need for any supplemental oxygen. Let your nurse know immediately if you develop excruciating calf pain. Excruciating calf pain can be accompanied with more than usual swelling, which is red, hot and tender on palpitation, and can be a sign of a blood clot. After surgery, you will meet with members of the acute pain service team. This team includes anesthesiologists and nurses. The acute pain service team will work with you, along with your surgeon, nurses, and physiotherapists, to manage your pain. The acute pain service team members will visit you regularly to assess you and make sure that your pain is controlled, side effects are managed, and that you are satisfied with your level of pain control. Part of this assessment includes asking you to rate or measure the intensity of your pain on a scale from 0 to 10. 0 indicates that you have no pain, and 10 indicates the worst pain you have ever felt. You will also be asked to describe what your pain feels like. For example, is your pain achy, sharp, throbbing, etc.? These assessment tools will help the acute pain service team and your doctors and nurses better understand how you are feeling so they can develop a plan to manage your pain. It's important to note that everyone feels pain differently, and even if you've had surgery before, you may feel your pain is different this time. How and why do we feel pain? When injured, our bodies produce inflammatory chemicals and signals that are sent from the injured site through our spinal cord to our brain. Once the signal reaches our brain, we become aware of the pain and how it makes us feel. Our bodies naturally try to suppress the pain, but it's not always enough, so taking pain medications helps control the pain. While in hospital, you will receive many different kinds of medication to control your pain. This is referred to as a multimodal analgesia, or pain management. The purpose of this approach is to attack pain at different levels along the pain pathway, from the site of the injury to the brain. You may receive medications such as Tylenol, anti-inflammatories, opioids, which are strong pain medications such as morphine, or peripheral nerve blocks to help manage your pain. Your nurse will give you long-acting pain medication on a scheduled basis, and you can also ask for fast-acting pain medication at times when the pain is most intense. The fast-acting medication takes approximately 30 minutes to start working. We recommend asking for the fast-acting pain medication before you do things that may cause you more pain, such as walking, exercising, or climbing stairs. Pain medication can sometimes cause side effects. The most common side effects include nausea and vomiting, dizziness, constipation, itchiness, and excessive sleepiness, which usually happens shortly after taking the medication. Most of these side effects can be treated, therefore it's important to tell your nurse about them. It's also important to tell your nurse if your pain medications are not controlling your pain. A peripheral nerve block may be offered to you by your anesthesiologist before your surgery or shortly after in the recovery room. A peripheral nerve block is a procedure where the anesthesiologist injects freezing medication around carefully selected nerves in the upper thigh, which temporarily prevents you from feeling or moving your limb. The purpose of the peripheral nerve block is to provide you with short-term pain relief post-operatively and to help you reduce the amount of pain medication you need to take after the surgery. The freezing medication injected will likely last from 6 to 24 hours, though we don't know exactly when your freezing will wear off. Therefore, if you have pain, please tell your nurse and ask for medication to help relieve your pain. Should the freezing not wear off within 24 hours, it is also important that you tell your nurse, so the acute pain service team and your surgeon can properly assess your situation. Besides taking pain medication, there are additional things that you can do to help manage your own pain. You can apply heat or ice to the site of the pain, deep breathing exercises, relaxation techniques, or distraction techniques, such as listening to music, watching TV, and reading, etc. Should you have any questions or concerns about your pain control while in hospital, please do not hesitate to let your doctors, nurses, and acute pain team know. We are available 24 hours a day, 7 days a week. Your nurse can call us through the hospital's paging system at your request. Do not bend from your waist more than 90 degrees when sitting or standing. Do not lift your knee higher than hip height on the operated side. Do not put your legs together or cross your legs at the knees or ankles. Do not twist your waist or rotate from your hip when sitting or standing. Do not turn your leg or ankle inward or outward in standing, sitting, or lying position. Do use a commode or raised toilet seat when using the washroom. Regarding sex, it's very important to remember your hip precautions. If you are engaging in intimate relations after surgery, it's recommended that the person who had surgery be on the bottom. Precautions are in place for 8 to 12 weeks following surgery, and as a result, some of your daily activities need to be managed a little more differently. The occupational therapist will teach you new techniques for managing your daily activities after surgery, as well as recommended equipment to help you maintain proper precautions. In general, toilet seats are too low and will cause you to put stress on your knee or place your hip at a greater than 90-degree angle. You will need to rent a raised toilet seat with arms that will help you with safe transfers on and off the toilet and provide you with extra assistance you need for standing. If you have a walk-in shower, that is ideal. You'll benefit from renting a shower chair so that you can sit while showering. If you have a bathtub, you'll need to rent a tub transfer bench, which is safer after surgery and also recommended so that you do not compromise your precautions when stepping in or out of the tub. The occupational therapist can practice with you in the hospital before you go home. Make sure you have a good chair to sit on at home that isn't too low. For example, sofas are often too low. They make it harder to stand without assistance and bend hip surgery patients at a greater than 90-degree angle. A dining room chair with arms or a wingback chair are both great choices. You can also place a pillow or a wedge cushion on top of the chair to make it a little higher if necessary. Dressing your upper body remains about the same, but due to your precautions, dressing your lower body will be more of a challenge. There are plenty of dressing aids available that can help you remain as independent as you were before the surgery. A reacher will help you put on your pants and underwear, and a long-handled shoehorn will help you with putting on your shoes. A sock aid is also helpful for putting on your socks. It is recommended that you rent or purchase all of your equipment and have it ready prior to your surgery. Some of the dressing aids, like the shoehorn and reacher, can be found at a dollar store. When you are ready to leave the hospital, you will go home in your own car. It is recommended that you get in the front passenger seat and move the seat all the way to the back to maximize legroom. You can also put a plastic bag on the seat to help you slide in and out. The occupational therapist will review this with you before discharge and can assist you if needed. Hip and knee surgery patients tend to stay in hospital for 2 to 3 days, but each person is different and the discharge date can vary, reflective of how each individual person is performing. Please plan for discharge on day 2. Please do not expect advance notice of being discharged from the hospital. Keep in mind that you have the potential to be discharged on the 2nd or 3rd day after your surgery. You and your family should have all the preparations for transportation home and the necessary environment modifications ready for the 2nd day after surgery, in anticipation of your potential discharge. Please have any rented equipment in your home ready. You may be discharged early in the morning or late in the afternoon, which will be determined during your hospital stay. The hospital will not delay your discharge because you are unprepared, so please ensure that all discharge preparations are made prior to admission to avoid complications. Please note that there is no option to remain in hospital for rehabilitation after elective surgery, so your cooperation is appreciated. If you have any questions or concerns pertaining your discharge planning, or if you live alone and would like information on respite and other places you can stay to recuperate after surgery, it's important that you contact the discharge coordinator for assistance prior to your surgical intervention. If you don't have family or friends available to assist with transportation back and forth to your rehabilitation or follow-up appointments, accessible transportation can be arranged by TransHelp, which operates through the region of Peel. An online application and further information can be found at www.peelregion.ca/TransHelp, or contact them by telephone at 905-791-1015. Advance notice of 5 to 10 business days is required in order to activate their services, so it is important that arrangements be made in advance. TransHelp services the region of Peel, including Brampton, Caledon, Mississauga, and some parts of Etobicoke, including Woodbine Racetrack, Etobicoke General Hospital, and Kipling Subway. The Community Care and Access Center, better known as the CCAC, will go into your home to provide rehabilitative services, completely funded through OHIP. The CCAC services will automatically be arranged by the team for you prior to your discharge from the hospital. The amount of sessions provided is dependent on the assessment that will be completed by the CCAC after your discharge. You will be given blood thinners as specified by your doctor for a duration anywhere from 10 days to 3 weeks. The blood thinner you will be taking is named enoxaparin, also referred to as Lovenox. This is a self-administered injection taken using a pre-filled syringe through your stomach. While you are in hospital, your nurse will educate you or the person who will be assisting you on how to administer this injection. You are responsible for administering this injection independently. The hospital cannot send someone in to administer this for you, so if you feel unable to administer these injections independently, it is important that you delegate a friend or family member to assist you. The practices of surgeons may vary. Your surgeon may administer a different blood thinner, so it is important that you follow any instruction that your specific surgeon may provide. If you require any dental work within the first year after your surgery, it's important that you take an antibiotic prior to your appointment to avoid potential infections, even if you are just having a cleaning. If you plan to see your dentist within the next 12 months, contact them about flagging your chart so they are aware that you've undergone surgical intervention prior to your appointment. Either your dentist or family doctor will write you the prescription required. Your dentist can inform you of how their process works. Do not drive until you've been cleared by your surgeon or physiotherapist. If you drive before you've been cleared and have an accident, your vehicle insurance will not cover you. The doctor will likely clear you to drive 4 to 6 weeks following your surgery. In addition, you cannot be taking any narcotics, as they may impair driving. Do not travel long distances for at least 3 months after surgery. This includes driving and flying. Sitting for prolonged periods of time can put you at risk of developing blood clots, in addition to the surgical area becoming stiff and impaired walking. In summary, please feel free to let your nurse, therapist, or doctor know about any concerns or questions that you may have before or after your surgery, or refer to your patient manual for more information. Thank you for watching.